Hi, I'm Dr. Schallenberger, and we're just getting ready now to do the fourth part in this lecture series that I'm presenting called Health, Aging, and Disease. It's all about energy. And if you haven't seen the previous three parts to this, what you're about to see here probably won't for sure, won't resonate that well to you. So take advantage of looking at the other parts, because I'm going to assume that those have been seen as we go through this. In this particular part, the discussion is going to be centered around bioenergy testing. Bioenergy testing is a testing system that I developed several years ago in order to be able to monitor how my patients were making energy. And of course, when I'm talking about energy in this context, I'm talking about cellular energy, how the cells convert oxygen into energy, which of course powers up everything that the cells do. That's a little bit different, well, it's a lot different than the energy that you and I tend to talk about when we say, well, I'm having a high energy day or I'm having a low energy day. That energy has to do more with the adrenal gland and other functions, such as how much sleep you got and that kind of thing. This form of energy is actually how well your cells are converting oxygen into energy. And we developed a testing device using an oxygen uptake system that is able to measure that and quantify it. And what we're going to do in today's, in this part 4 session is we're going to look at how bioenergy testing can be used in every practitioner's clinical practice. Okay, so let's get on with it. I did want to mention once again that I have written 2 books that specifically deal with this issue. One is called Bursting with Energy. That is specifically about aging and cellular energy. And the other book is the Type 2 Diabetes Breakthrough, and that is about obviously diabetes and cellular energy. And those books are well referenced, they're well cited, and they go into greater detail than this video will cover on this subject. So I encourage you, if you have any further interest, to go ahead and pick up one of those books or both and take a look at them. Today's talk is entitled Using Bioenergy Testing to Maximize Health and Slow Aging. And like I say, what we're going to do is we're going to go through some case studies that I have, and until you, as either a practitioner or as just an interested layperson, learn better how to use the information that you can obtain from bioenergy testing to fine-tune your health program. I've been practicing medicine for going on 40 years now. And I can tell you that over those years, I've heard literally thousands and thousands of people tell me about the symptoms they have or the diseases they have. And as they're telling me this, although I don't necessarily give them this feedback, what's going through my head is, you know what, you're telling me about a disease you have or all these symptoms and conditions that you have, and all of this stuff is preventable. You didn't have to have it. Now, I don't blame people because, they don't always know. But the point is that as a practitioner, I've come to the conclusion that the best thing a physician can do is to work with his patients to make sure that they don't get sick. Not just to focus on helping the sick, but to focus on helping our people not get sick in the first place at all. So in terms of preventing illness and maximizing health, there is, of all the things that we can do, the single most fundamental thing is to do whatever we can do to make sure that our patients are having an abundance of cellular energy. In other words, that they're able to convert oxygen to energy in a very, very efficient way. There's nothing else that can impact in a more powerful way on them than exactly that. In the part 3 of this series, we discuss the kinds of things that people can do to do that. And we broke it down into diet, we broke it down into exercise, various things that you take, and that would include anything from herbs to vitamins to supplements. We broke it down also into how your body deals with the stress that you're under, and in that context, we're not just talking about emotional stress, but I'm also talking about, say, the stress from electromagnetic pollution and from environmental pollution, and stress from medications, and stress from not enough sleep and that kind of thing. And finally, we talked about detoxification, because when toxins get into our system, they can block the way our cells convert oxygen to energy and tend to shut down our whole energy-making process. And we looked at how that was done and how we can manipulate those things towards better health. Well, today we're going to specifically look at real-life case examples using specifically bioenergy testing and the results from this, and kind of go over this so that by the end of today you should have a pretty good idea of how you can use this testing to help your patients improve their cellular energy, and in that way do more for them than any other single thing you're going to do for them today. All of those things that I mentioned, the interventions and the factors that play into cellular energy production, all of those things can basically be broken down into 4 components. I call these the 4 quadrants of health. One is how you eat, one is how you exercise, one is the lifestyle choices that you choose to deal with stress or impact the way stress affects your body, and one is the various supplements that you take, whether it's hormones or vitamins or that kind of thing. Now, all of that needs to be individualized. In other words, if you were to read my book, one of my books, and I will talk about all 4 of those things, but I don't give the answer that everybody ought to just go out and eat this way, exercise this way, take these supplements. It's all individualized. And there are literally some people that do not have to take hardly any supplements at all. And there are other people that need to take 20 or 30. There are some people that need to exercise a lot more than others. There are even some people that, from all testing purposes, don't seem to need to exercise at all. And so all of these things can vary tremendously depending on other aspects of our lifestyle, and certainly depending on our genetics. So the main thrust of modern medicine over the next, the future of medicine is going to stem around being able to individualize therapy so that it's right for each appropriate person. Find the diet that's correct with them. Find the exercise program that's correct for them, and the supplement program and so forth that works for that individual. And there is no better way to do that than to examine cellular energy production. There's no better way to do that than to look at the results of these bioenergy tests. Because whatever I'm doing with my patient that improves or maximizes their cellular energy production, that's something that works for them. But if I'm telling my patient, eat this way, exercise this way, do these things, make these changes in your life, and they're not really adding up to an improvement in cellular energy production, then I'm off track. Then I haven't found the correct key for that particular patient's genetics. And I need to go back to the drawing board and try to come up with another plan. Another way of saying this is, until I come up with a plan for a patient that shows an improvement, or at the very least a maintenance of their cellular energy production, then I haven't done my job as a physician yet. Now we're going to see at least one case in here where that worked out pretty nicely, and of course I have hundreds of cases where that's worked out nicely. Sometimes it's pretty easy to come up with the correct prescription, and sometimes it's not. But if you don't at the first hand, just go back and make a few changes and try again, and ultimately you will get there. Okay, so we're going to have a few minutes here just to kind of review what we learned in the last part. If you look at the slide here, it talks about what you can learn from bioenergy testing. I've broken this down into 6 components. As you'll see, there's actually more that you can learn from bioenergy testing. But these are sort of the 6 components I want to focus on right now. Certainly, it's about cellular energy production. ATP is how that energy is harnessed, so we're measuring ATP. So we want to know in terms of energy production, these first 4. One is total resting ATP production, when you're just sitting down doing nothing. How well or how efficiently are you converting oxygen into energy? 2 is resting ATP production from fat versus carbohydrates. You know, we indicated that as people move from being in a healthy condition to being a less healthy or closer towards a disease condition, one of the things that does happen to them is that they rely more and more on carbohydrate for energy production and less on fat. The reason being that your body has to be more efficient to burn fat than it does carbohydrate, and as it loses efficiency, it starts leaning more and more on carbohydrate. So we want to know exactly how much of that energy is coming from fat when in a resting state. So these are two resting measurements. The other two measurements are exercise measurements. We put people on a bicycle, we exercise them, and as they're on a bicycle, we watch how they're taking in oxygen and how that oxygen is being converted to carbon dioxide. And so these are maximal numbers of energy. So we have maximal aerobic ATP production, and then we have maximal aerobic ATP production from fat. So as we go through the case studies, this is what you're going to see us really talk about. We'll look at that, we'll evaluate our patients along that line, and then we'll make decisions regarding therapy for them based upon how they scored on this. And the other thing we're going to look at is the maximum amount of work that they could perform, aerobic work, and finally their biological age. And we'll talk about these, and although these things might be less than perfectly clear to you right now, hopefully by the time we're finished, you'll have a really good understanding of how you can use these things to help people. This is a slide that you're going to probably have seen, I think, in all 4 parts of this lecture series. Let's look at it again and just review it once again, because this is the gist of why somebody would even want to do anything like this. Over here we have a profile, or at least an energy profile, of a healthy individual. And at the top right here is maximum ATP production. At this line right here is maximum mitochondrial ATP production. Now, the mitochondrial ATP production is the kind of ATP that's produced from oxygen. All the ATP, or energy that's produced from oxygen, is produced in the mitochondria. So another way of saying that this line is the maximum amount of energy you can produce from oxygen. Up in here, this section that goes from here to here takes into account the amount of ATP your body can make without oxygen. So there's with oxygen energy and without oxygen energy. You add the two of them together and you have the sum total of all the energy you can make. For those of you that are familiar with the concept of VO2 max, this point would be the point of VO2 max. In other words, it's the maximum amount of oxygen or maximum amount of energy that your cells can make. Now, we're not interested in measuring this component, the amount of energy your cells can make without oxygen, because as people are healthy and they become diseased, actually this component increases. So that's not too helpful for us. The sicker you get, the better you do that. So we're not too happy about that. What we really want to focus on is how much energy your body can make from oxygen. So that's this column right in here. And here's your healthy person. And they meet the qualifications for the maximum amount of mitochondrial energy production that they can do. And so there's 2 ways they can produce energy from oxygen. One is by burning glucose or sugar, and the other is by burning fat. And so let's watch and just kind of review this. Look what happens to somebody as they're moving from being totally healthy to being diseased. The first stage they go through is a stage wherein their actual mitochondrial energy production is unchanged. Notice this is the same. But the dynamics in which they make the energy has changed, such that they're making more of their cellular energy from glucose and less from fat. As this proceeds, as this goes onward, and onward may mean for 5, 10, 15, 20 years. This is a slow process moving from health to disease. It doesn't happen overnight. But as time progresses, they get into a second stage here, wherein now for the first time cellular energy production has been decreased. Now it's gone down. And such that they're burning less energy from glucose and less energy from fat. And so their total cellular energy levels have been diminished. As we go through the test results, I'm going to be talking to you about something called energy quotient. Energy quotient means the amount of cellular energy, the maximum amount of cellular energy that can be produced in a given person compared to what would be usual and typical and considered healthy. So it's basically the ratio of this number to that number. If it's 100%, if your EQ is 100%, then you're in this column. If your EQ is less than 100%, you're over in this column. Now notice what's happened though in this third column here. Even though cellular energy production from the mitochondria has gone down, anaerobic energy production makes up for it so that the total energy production, or VO2 max, remains unchanged. And I make a particular note of this because there are many people out there in the health world that think the VO2 max is a reliable number. And what I'm here to tell you is, from an athletic perspective, yes. Those are the athletes that win the race, is the ones that have the highest VO2 max. But from a health perspective, VO2 max is basically useless. Because as you can see from the third column here, here's a person that has dramatically decreased shift in the dynamics of their cellular energy production, and yet their VO2 max remains unchanged. And then finally, the final column is when the VO2 max actually does go down. Their total energy production goes down, and their cellular or mitochondrial energy production goes down even more. This is where they're sick and diseased. Now, I don't know that in this stock of charts we're going to go over today that I'm actually looking at anybody that's diseased. I don't know, I just pulled these out of the library. But that's not really the purpose for doing bioenergy testing. Even though we can use bioenergy testing for people that are in that fourth column and actually have a disease, and use the results to help move them left, nonetheless, from the purposes of prevention, from the purposes that really get me excited about being a doctor, what I want to do is find people that are in these two columns in the middle here. They don't have any disease at all. They're getting around, they're functioning, they probably have functional symptoms. Maybe they don't feel as well, their energy is not quite as well, they can't ride their bike up the hill quite as well as they used to. Maybe their sexual life isn't quite what it used to. And they have some digestion disturbances. We call all these things kind of functional symptoms, or quote, healthy for your age. This is where I like to work. I like to get people before they're diseased, before they've reached this column, and then move them that back way. And here's the point. Without bioenergy testing, without the results that you're going to see on this testing procedure, you have no way of identifying who's in here. You don't know them from here, or from this column for that matter. So that's why I consider this test to be so absolutely critical for physicians to use to be able to help their patients prevent the onset of disease, and in fact slow down the very process of aging. Because aging is just like any disease. In fact, it's got pathological processes that are associated with decreased energy production at a cellular level, just like disease does. So as we're moving this way and getting closer to disease, we're also moving this way and getting closer to the ravages of aging process. Okay, so that's the review. Let's start talking about our first person here. This is a 39-year-old healthy is in quotations because it just, again, I've mentioned this before, but just because you don't have any symptoms and just because you went and saw the doctor and the doctor says your blood sugar's good, your chemistry panel's good, etc., doesn't mean you're healthy. Health is not the absence of symptoms. It's not the absence of a disease or pathology. Health is the presence of something, and that something is cellular energy production. So we define health as having maximal cellular energy production. However, this man is using the old definition of health. Well, there's nothing wrong with me. So he felt good. He was asymptomatic. His blood pressure's good. His cholesterol levels, everything's good with this guy. He's overweight. And for all extensive purposes, most people would describe him as being a healthy 39-year-old man. On physical examination, he's got a normal examination, except he's got some excessive fat around the midsection. But other than that, he's normal. Pretty much fits the profile for most 39-year-old healthy men. He gets 6 hours of sleep. He drinks 2 cups of coffee a day to kind of make up for the fact that he's not getting enough sleep. And I put coffee in quotation marks, cups in quotation marks, because you know, when you're a doctor and the patient tells you I take 2 cups, you got to like understand that in most cases patients are not talking about a 4-ounce cup. They could be talking about a jumbo 16-ounce cup. So 2 cups of coffee by today's standards may mean an entire pot of coffee. So he drinks a lot of coffee. He, like most 39-year-old men, is getting little to no exercise, doesn't take any supplements. No need to, he feels great. Why take supplements? He doesn't have any history for excessive toxic exposure. In other words, he hasn't been working in an occupation, or he doesn't have any hobbies where he's being exposed to various toxins or poisons. He is a non-smoker. He doesn't take drugs of any sort, pharmaceutical or otherwise. And so from all extents and purposes, he's a pretty normal guy. Pretty normal, usual guy. Now, what if I were to tell you that when you see his cellular energy results, you're going to find out he's not a healthy guy. He's in one of those middle 2 columns. So let's take a look at this, because this guy is our classic candidate for doing something with. We can interact with this man along those 4 areas. We can interact with his diet, we can interact with exercise, we can find out what supplements he needs, and we can interact with the way his body deals with stress in those 4 ways to move him over actually to that healthy column and to move him further away from disease and premature aging. So let's look at him as a good example. Here's his test reports. Now we're going to go over this in more detail, but I'm just going to kind of run through them right now. His EQ, which is the maximum amount of energy that he can make from oxygen in his cells, and EQ stands for energy quotient. The reason that stands for energy quotient is on the top end of the quotient is how much energy he can make from oxygen. On the bottom energy of the quotient is what's usual and typical for the average healthy 39-year-old man. So I'm comparing him to a healthy 39-year-old man. Now, his number is 76. So in terms of his maximum ability to generate ATP, his maximum ability to generate aerobic cellular energy production is at 76%. So he's actually a quarter below what he should be. And this is kind of a point that we were making in the first part of this series, where we talked about EOMD, early onset mitochondrial dysfunction. That's where the mitochondria are, there's nothing wrong with them, they're not diseased, but they just don't produce energy efficiently, even in young, otherwise healthy, asymptomatic people. So this gentleman would have what you call EOMD, early onset mitochondrial dysfunction. And if you remember from part 1, EOMD leads to disease and premature aging. So he's already on the path. We want to turn him around. Without me knowing that number, I'd have no clue I had to do anything for him. It'd be kind of like if I had a patient come in, let's say I had him come in to see me, and I didn't have a blood pressure cuff. And let's say his blood pressure is elevated. I'd have no way of telling him, listen, you've got to make some changes regarding your blood pressure. It's too high. I couldn't tell him that. Furthermore, if I told him you've got to do something for your blood pressure and I didn't have a way to measure blood pressure, I couldn't tell if what I told him actually worked. So it's absolutely critical for physicians to measure how well their patients make energy on a cellular level. Otherwise, they're going to miss people like this and thousands more like them. But his ability to make energy is curtailed. He's only at 76%. That's his maximum energy production. When we look at his resting energy production, now I call this M factor, M standing for metabolism. So actually, this particular number here is his resting metabolism, or basal metabolic metabolism, BMR. And only it's another quotient, so that I measure his metabolism, his resting energy production, and I put it over what would be usual and typical for a male, his size, height, weight, and age. And so it's a percentage. So his resting metabolism is at 92% of what would be expected or desired. C factor is his resting energy production from fat it's at 50%. So we'll talk to you a little bit about that in a sec. Fat burning factor is his maximum energy production from fat, which is at 78%. So you don't have to be even that well versed in bioenergy testing to know that we've got a problem here. Except for this resting metabolism, all these numbers look pretty low. What biological age is the computer looks at these numbers here, and it adds them up and kind of takes an average and quantifies them. And then it finds the age bracket that most typically would show up with those numbers in healthy individuals. And then it uses that age bracket to define the biological age. Another way of saying that is that when the computer analyzes his numbers, it finds out that his numbers match up with the average 66-year-old male. Now keep in mind, this guy's 39. So his biological age is way higher than his actual chronological age. He is aging prematurely. He's aging more rapidly than he has to. That's kind of a motivational thing. Hopefully when he sees that number, he'll be motivated to do something, because lots of times it's hard to take a person who feels great, has nothing wrong with them along standard measurements. It's pretty hard to tell them, oh yeah, by the way, I want you to start changing the way you eat, I want you to start changing the way you exercise and such. But it won't be hard to teach him that, because he's going to look at these numbers, particularly when it comes to the biological age, and he's going to say, you know what, I'm not really happy with that. What do I need to do to change that? I don't want to see that anymore on my chart. Also, the test gives us a lot of other information. I won't go over all the information on this in this lecture series. I'm just going to hit some of the basic stuff. But the whole testing process, which takes about 40 minutes, does give the physician an abundance of information that he can use to work with his patients. One of them is heart factor. Heart factor is a calculated cardiac output. That's how strong his heart is pumping, gives you an idea of what the kind of condition his heart in. Remember, heart's a muscle, so it's just like any other muscle. It can become weak or it can become strong. He's got a cardiac output of 78% of predicted. Not that great. He's basically out of shape. His lung factor is 102% of predicted. That would be, for doctors, that's FVC, forced vital capacity. It's basically how much air you can get into your lungs. He's at 102%, so his lungs are good to go. In fact, that's the first thing that looks good to go on this guy. He's got good lungs. These are the amount of calories that he would need to maintain in order to lose weight. Now, this calorie weight loss is based upon exercising for 30 minutes every day according to the exact exercise prescription I give him. The computer is able to measure that. It can measure how many calories he's burning while he exercises. He can measure how many calories he burns when he's just sitting there doing nothing. We add them together with an exercise program, and I can tell him how many calories he's going to burn in a given day exercising this way. And in his case, it comes out to 2,100 calories, which you subtract 500, and that means if he stays at 1,678 calories a day and exercises for 30 minutes the way I tell him, that he will lose 1 pound of fat every week. So this is the kind of caloric weight loss, caloric stance he needs to be in to lose weight. Now, for longevity purposes, and we know that a caloric restriction will extend his life and slow down the aging process. That's well established. So we can actually give him some real guidelines without having to guess. Because what the computer will do is in the same way that it computed the amount of calories that he rests and he exercises by, it will now look at that and come up with a recommended caloric intake for him, even after he's lost his weight, or if he doesn't have to lose weight. This is what he should stay on for the rest of his life. 1,750 calories. Now, if that looks a lot like the amount he needs to be on to lose weight, that's correct, but there is a difference. The computer calculates on this that he's going to be exercising for 30 minutes every day, whereas on this one, it's 30 minutes 3 times a week. So that's why it kind of adds up that way. But that's a very handy number to know. Suppose he came in, he didn't need to lose any weight at all, and he said to me, you know, I know caloric restriction will lengthen my life and decrease my chance of getting disease, So what would you recommend? What's the amount of calories I need to be on? I can tell him exactly how many calories. I can say 1,750 calories is what you need to be on. Go see my nutritionist. She's going to tell you exactly how to accomplish that. And then finally, and very importantly, is the exercise zone. So that when I tell this patient to exercise, I'm not just going to say, go exercise. I'm not going to send them down to the gym and say, talk to one of the trainers down there and they'll come up with a formula for you. I'm going to tell them exactly the level of exercise that his particular body needs at this particular stage in his life. Will that change? Yeah, because he doesn't exercise at all. So right now he's in lousy shape. So he's going to have an exercise zone that shows that he's in lousy shape. As he gets in better and better shape, that exercise zone will change, and as we continue to measure his bioenergy testing report, that'll be reflected on his results. But for right now, his exercise zone is a heart rate that goes between 94 and 125. Amazingly, that's not all that bad. So in terms of being in shape and being in condition, that's not so bad. So even though we've got a man here that doesn't exercise at all and is overweight, he's not in all that bad a physical condition. Of course, he's young. You'd expect that. He won't be at this level of physical condition in another 10 to 20 years. I can more or less promise you that. Okay, so we're going to break these down now and go over each one individually. But not now. Right now, we're going to look at EQ, or energy quotient. Remember, his energy quotient, which is, again, as a review, is the maximum amount of energy that his cells can make with oxygen. That's what that means. Is 76%, not so good. Again, I told you that means he's got EOMD. He already has early onset mitochondrial dysfunction. You wouldn't have known this had you not done the bioenergy test, but now we know. This slide comes from the first couple of parts to this lecture series. There are two basic reasons that would drive a man like this to have EOMD. One is things that happen before the mitochondria, things that happen outside of the mitochondria. And the other is things that happen in the mitochondria itself. So in terms of things that happen pre-mitochondrial, these would be the sorts of things. One would be, these are the kinds of things that could bring him to this. Now, I, as his physician, am going to have to figure out which one of these things is playing a role in him and come up with a program that works for those things. So the first thing is decreased lipolysis, a decreased ability to break down fat. So let's go to this slide here. And if you remember that from the previous parts here, here's the mitochondria. And here's his fat stores, and he's got to convert fat into energy. He's not doing that very well. So what would be the factors? One is insulin. Insulin will block the breakdown of fat. Also, not having enough T3, thyroid hormone, will interfere with the breakdown of fat, and also not having enough cortisol, and also not having enough carnitine or not having enough NAD. NAD is a niacin-based energy intermediate that you can become very deficient in very quickly. So any one of those things, too much insulin, not enough cortisol, not enough T3, not enough carnitine, not enough NAD, any one of those factors can cause him to have this particular problem here of decreased lipolysis. Now, I automatically know he's got that, and I know that because we already saw on his fat studies previously that he had that. If you go back here again, this is C factors is resting fat burning, that's low. Fat burning factors is exercise fat burning, that's low. So I already know he can't burn fat well. Also, he's overweight, that tells me. So I know right here I'm going to have to do something here. I'm going to have to either give him thyroid if he needs it. I'm going to have to give him cortisol if he needs it. I'm going to have to decrease his insulin levels if those are issues. I'm going to have to figure out why it is that he won't burn fat. When we come up with this prescription, I'll show you what I came up with him. Another cause would be hypoglycemia, low blood sugar. But this guy feels great, so I know he doesn't have that. The classic finding of low blood sugar is sort of a real sag in energy towards the latter middle part of the afternoon. He doesn't have that at all. So he doesn't have hypoglycemia. Ischemia is normally something that's going to happen in older people with occluded circulation. I think at his age that's probably unlikely, so I'll tend to write off ischemia for him. Hypoxia is a low oxygen level in his bloodstream. Now I can kind of actually test for that because I have an O2 sat device that we routinely take measurements on while the patient is getting the bioenergy testing, and I happen to know that his O2 sats are great. So he doesn't smoke, he has good O2 sats, he doesn't have a history of asthma or any reactive airway disease, and so I've got a pretty good idea that hypoxia is not a big player on him. The only thing that could impact him in this regard would be carbon monoxide poisoning. So in the back of my head I think about that, but that's hard to imagine in a patient that feels as good as he does. So, so far I know he has this problem. The rest of these look like they're okay. Decreased methylation. Decreased methylation is something that it can lead to low energy states, low cellular energy production. Just remember that you make your ADP, you make that from methylation. You make carnitine from methylation. You make coenzyme Q10 from methylation. And so you make some of the major components to the entire mitochondrial function from methylation. So if he's not doing that process so well, then he's going to need help there, or he's not going to be able to maximize the cellular energy production. This might be a problem with him, because you can have methylation disorders as a 3-year-old. So young people can have methylation disorders, not that uncommon. A major thing that can cause methylation disorders is toxicity with the heavy metal mercury, and that's very common. So I'm thinking this may be an issue with him. I would look in his mouth, and I would see how many silver amalgams he has. If he has, several silver amalgams, certainly if he has a mouthful of silver amalgams, I would say, the odds are very good he's got mercury toxicity, and this might definitely be an issue. So one way to kind of assess his methylation status is by looking at his serum homocysteine level. If the serum homocysteine level is elevated, then that might indicate he has a methylation problem. Another way is to actually look at some of the results on this test. And I'm not going to get into that particular aspect of bioenergy testing, but there is a way that you as a physician can use the bioenergy testing to come up with what I call a methylation factor. It'll give you an idea as to whether or not he has a methylation disorder. But for right now, I'm going to get his homocysteine level, and I'm going to think, he might just have a methylation disorder since he has so many of these mercury-containing silver amalgams in his mouth. Finally, inflammation. That's probably a factor with him as well. He has the central abdominal obesity. We know that this is a hallmark of inflammation. We could do some tests like a C-reactive protein to give us an index if he's got inflammation going on. When it comes to testing, by the way, and we're talking about lipolysis, we could certainly measure his hormones. We could measure his T3. We could look how his T3 relates out to T4. We could look at his cortisol levels. We could look at his insulin levels and start having an idea of what we're doing. But as I go through the pre-mitochondrial factors, I'm thinking that certainly number 1 is a potential issue with him, or was a for sure issue with him. Number 4 and 5 are potential issues with him, all of which we need to treat if we're going to improve his cellular energy production. Now, when we get right into the mitochondria itself, the kinds of things that could affect him are just flat-out toxicity and infections. He has no evidence of any chronic infections. But I'll probably run a hair analysis on him to screen him from heavy metal toxicity just to see. We all have heavy metal toxicity, but just to see the level of the toxicity that he has, because if he's got a lot of lead or arsenic or cadmium or mercury, then that's something probably we're going to want to look at with him. Stress, the only thing that's stressful about him is the fact that he drinks too much coffee, he doesn't get enough sleep, and he doesn't exercise. And yes, while exercise itself is a stress, not getting exercise is also a stress. So he's got some stressful issues going along. So I would say, yes, definitely I would include 2 in here. Nutritional deficiencies. it's hard to imagine anybody this day and age, unless they're really paying attention very closely to what they eat, and the average person doesn't do that. It's hard to imagine anybody who's not taking nutritional supplements to have perfect state of nutrition. So I'm sure there's some sort of nutritional deficiencies going on with him. As I mentioned in the previous part 3 of this lecture series, this day and age, there's a couple things working against having perfect nutrition. One would be the fact that we live in an era where the amount of environmental toxins that we have to deal with is thousands of times greater than our human body has ever seen before. And I'm just not talking about toxins in the sense of pesticides and heavy metals. I'm also talking toxins in the sense of electromagnetic frequencies, cell phones, and so forth and so on. So our human bodies are being bombarded constantly by these toxins. How do we get rid of the toxins? We get rid of the toxins through cellular energy production. So the more toxins we have to get rid of, the more cellular energy we need. And so we're going to be burning up all the vitamins, especially the B vitamins. It's so intrinsic to making cellular energy. We'll be using them at a much faster rate. So one of the reasons essentially everybody has nutritional deficiencies, can't get around it, folks, sorry. One of the reasons is we just have a much higher need for vitamins and minerals than we ever had before. And you combine that with the fact that our diets are worse, the foodstuffs themselves are worse for agricultural reasons. When you go out and buy say a head of lettuce today, you're going to have less nutrient value in it than if you'd have bought the same head of lettuce 50 years ago. So we've got a double whammy where on the one hand our diets just don't provide as much nutrition as they used to. On the other hand, we have a much greater need of more nutrition than we used to. Add those two together and you come up with the fact that all of us have nutritional deficiencies unless we're taking supplements to do something about that. So I would definitely put that on his list of possibilities. Now if his EQ were good, I would say, you know what? He's okay in all these components. So if his, I think we might talk to see one case there where the EQ is actually really good. In which case you'd say, look, your EQ is good, so you're not taking any vitamins. Guess what? At this point in your life, you don't need to. It's all working for you. Hormonal deficiencies, except for thyroid hormone, hormonal deficiency in a 39-year-old is not common. Thyroid hormone we can see. And decreased fitness, we can certainly say that, yeah, he's got an issue around that. So as we're going through this and we look at this, these are the things as a physician I'm adding up and I'm starting to scribble on the chart. And I'm starting to say, you know, we got to do something to work on the way he breaks down fat. We got to check his methylation status. We've got to check his inflammatory status. We've got to check his nutritional status, got to look at toxicity and get him on an exercise program and maybe check his thyroid hormones, okay? All right, so that's EQ. That's a heck of a lot of things that I can think about as a physician to dial in on this guy who is, quote, supposedly healthy. Now let's look at the next factor. The next factor is called M factor, M standing for metabolism, because that's what it means. It's resting ATP production. He's at 92. Okay, so that's 92% of what would be predicted for him. Actually, anything between 90 and 100 is usually normal. We consider that normal. If it starts getting over a number, I think he's got a hypermetabolism, and I would start thinking of things that give you a hypermetabolism, such as a hypermetabolic or hyperthyroid type of condition. Anyway, he looks pretty good here. I think his resting metabolism is actually pretty good. Now that tells me that his thyroid must be good and his cortisol production must be good. So by adding up the information I got from EQ, he's not burning fat well, to the information that I'm looking at this, I can say, you know, probably the major reason he's not burning fat well is not to do with his thyroid, not to do with his cortisol, but it might be insulin. That might be in there. So why is he gaining weight then? The question then comes, if it's not his metabolic factor that's to account for why he's burning weight, can he burn fat well or does he eat too much? And we can figure that out from some of the other results on the test, so like looking at his total calories. His total calories to be healthy were something in the order of what, I think it was 17, let's go back and look. was 1,750. So if we compute his calories out, and my dietitian computes his calories out to be 2,200, we'll say, yeah, one of the things he does is he eats too much. But the other thing is, can he burn fat? So we're going to now look at the next two factors that bioenergy testing tells us. And these may be some of the more important factors that I can ever measure on my patient. And that is, how well does he burn fat? So let's move on. Nothing wrong with his metabolism. Let's see how well he can burn fat. His C factor, which equals resting fat energy production. So how much energy is he producing from fat while he's at rest, is only at 50. Now, what 50 means is, on the scale, the way this test works, when your C factor is 50, that means at resting. When you're resting, you're not burning any fat at all. You're living simply 100% off sugar. So is that possible? And the answer is, yeah, it's very possible. Here's a case where you see this. You might even see some more cases. It's not that unusual to find somebody who in a sitting down, resting condition is living completely off sugar. Now, there would be basically two ways to explain this. One way could be if the person is what we call a fast oxidizer type. A fast oxidizer type is somebody who doesn't burn fat directly. They burn fat indirectly. They burn fat, they just don't burn it directly. So to go back to this slide here, where we see fat coming in like this and being burned directly in the mitochondria, fast oxidizers don't tend to do that. They tend to convert fat to glucose and then burn the fat this way. So they burn fat this way. That's a fast oxidizer type. So one reason that he could be burning no fat at all at rest is because he's a fast oxidizer, and he's burning his fat by converting it to sugar, and he's burning sugar at rest. Another way, another explanation could be, is that he's a slow oxidizer, and he doesn't burn fat through sugar, and he just flat out doesn't burn fat very well. Now, if I have to look at this guy who's gaining weight, I would say he's probably a slow oxidizer. The other thing about a fast oxidizers should have a pretty high energy quotient, should have a pretty high EQ. It's the fast oxidizers that have the highest EQs. Doesn't mean a slow oxidizer can't have a high EQ, just means that genetically speaking, fast oxidizers tend to have the highest EQs. Fast oxidizers, by the way, you can kind of recognize them when you see them. They're the string bean types. They're the ones that tend to do best in the long distance events. They're your long distance cyclists. They're your long distance runners. The slow oxidizers tend to be the body types that work best in the short distance events. So I can look at this guy and say, you know what, he's putting on weight, he's overweight, he's probably not a fast oxidizer. Not only that, his EQ is low, so he's probably not a fast oxidizer. So I'm going to assume that this guy is in fact a slow oxidizer who's not burning any fat, and that's why he can't lose weight, and that's why he's gradually gaining weight. This guy left to his own devices, I see him in another 10 years, he may be 50, 60 pounds overweight. We've seen this a lot. Because no matter what kind of oxidizer you are, as you age, you're going to get to be slower. So if you're at one end, if you're at the fast oxidizer end of the spectrum when you're 20 years old, when you're 40 or 50 years old, you may have moved a lot closer to the slow oxidizer end of the spectrum. Now, aging will take a fast oxidizer, move them more towards a slow oxidizer. So will disease, so will bad eating habits, so will nutritional deficiencies, so will toxicity, all move you away from fast oxidizer. And about the only thing that's going to move you closer to a fast oxidizer is correcting those things, and especially exercise. So exercise, if done appropriately and done enough, can take a slow oxidizer and move them more in the direction of that fast oxidizer type. But I can look at him right now and say one of the major problems he has is he doesn't burn fat at rest. So what would be the main reason why an individual didn't burn fat well at rest? The main reason is implied in this title here, this designation I gave it of C factor. What does that C stand for? It stands for carbohydrate. Almost always, I don't know, 80, 85, maybe 90% of the time, that resting fat metabolism is low, almost always, it's because the person eats too many carbohydrates. Here's how it works. two ways, basically. One, when they eat too many carbohydrates, your body can't store carbohydrate to speak of it. So what's it going to do with it? It's got to burn it. So your cells are going to have to burn the carbohydrate you just ate. If they're busy burning carbohydrate, what can't they burn? They can't burn fat. Secondly, when you eat excessive amount of carbohydrate, you're going to produce an excessive amount of hormone insulin, and we've already seen that the hormone insulin blocks fat utilization. So those are two reasons that eating too much carbohydrate will cause you to not burn fat well in a resting state. So how much carbohydrate is too much? That varies enormously. If you're a slow oxidizer, almost any amount of carbohydrate may be too much. If you're a faster oxidizer, it takes a lot more carbohydrate to be too much. So it varies tremendously. I can't just come up with a number. I can't write in chapter 4 of my book and say this is the exact amount of carbohydrate you could eat, because it varies from person to person, depending on so many factors. But I can tell you, from this particular number, whatever amount of carbohydrate he's eaten is way more than he should be eating. Okay, so based upon that, just to recap, a C factor of 50 means zero fat metabolism at rest. That number should be at least greater than 90, and perfect is 100. You don't see a lot of perfects, and probably the only way you're going to see a perfect 100 is if the person you're dealing with is on a very, very strict, amazingly good low carbohydrate program. We already kind of dealt with this. Is he a fast oxidizer? No, he's not. How do we know? Because his EQ is low and because he's gaining weight. Again, the fast oxidizers are the string bean types. This guy's more of a mesomorphic type. So this is probably a carbohydrate effect. What other possibilities could they be? We already talked about those. Could be that he doesn't have enough thyroid, doesn't have enough adrenal, but we ruled that out by knowing that his M factor, his resting metabolism, is okay. So we're pretty much sure that the big problem this guy has is with eating excessive amounts of carbohydrate. So what are we going to do with him? Well, I'll tell you right now what we're going to do with him. We're going to put him on a very, very low carbohydrate diet. And then we're going to bring him back in about 2 or 3 weeks. And we're going to test his resting C factor again. It only takes a few minutes. And if it's gone from 50 to 80, as I suspect it will, if it's dramatically improved, then we're going to know for sure, yeah, he's eating way too many carbs. And this is something we've learned about this guy, that he's a slow oxidizer and he really has to watch his carbohydrate intake. In essence, when you ask the question, what's the correct amount of carbohydrate for an individual person? The correct amount of carbohydrate is whatever carbohydrate leads him to have a C factor greater than 90. That's the answer to that question. Now, I do want to mention that when the computer is measuring resting fat metabolism and it says it's low, and it says it's low due to too much carbohydrate, we're talking about the amount of carbohydrate that's in the diet for the last 4 to 5 days. That's what is going to determine this. So if I have a person that, all the time eats too much carbohydrate, but 4 to 5 days before the test went on a low carbohydrate diet, and his number comes out pretty good, that's why. So you always got to kind of make sure that the diet that the patient's been eating in terms of carbohydrate content for the 3 to 4 or 5 days prior to the test is pretty representative for what he normally eats. Okay, so far we've gone through EQ, we've gone through M factor, we've gone through C factor, resting fat burning metabolism. Let's take it in now to fat burning factor, which is his maximal fat burning metabolism. He doesn't burn fat at all at rest, but can he burn fat? And the answer is yes. He can do it at least 76% well. So he has the mechanism for burning fat. He just doesn't do it at rest because he eats too many carbohydrate. But that 76 isn't perfect, so he does have impaired fat metabolism. So what would cause that? Well, let's go back and look at the slide. He's not doing this very well. Notice that he has to burn fat in order to get that fat burning factor high through the mitochondria, so that if there's anything wrong in this mitochondria, that number is going to be lowered. So in essence, anything that influences the mitochondria will influence the fat burning factor. That could be anything in the Krebs cycle, Could be anything in oxidative phosphorylation. All of these factors come to play. All of it, in fact, the exact same factors that came to play in his EQ. So by dealing with his EQ the way we already have, we're already pretty much dealing with fat burning factor. Let's see. So the causes to impaired fat metabolism is basically the same as the EQ. But it also could be insulin, too much insulin, not enough carnitine, not enough niacin. These other factors come to play with how well you can burn fat too. Lipoic acid is a critical component for fat metabolism. Human growth hormone, that's spelled wrong, but human growth hormone should be measured in this patient. He's 39. He could have low growth hormone levels. We should measure that on him. We also already talked about thyroid and cortisol. So by looking at his low fat burning factor, that's given us some clues of where we should go to kind of investigate him a little bit more. Okay, next one is his biological age. His biological age is 66. He's 39, so he's not altogether happy with that. But he's well motivated. It's created a motivation in him. Now, biological age can be depressing too. So there's two ways this guy could react to his biological age. One would be, hey, I'm so motivated, I can't, I'm embarrassed to have a biological age of 66. I've got to do better than that. But the other could be, he could be walking out of the clinic thinking, this is depressing. I'm 39, I got a biological age of 66, the heck with it, and just give up. We see that reaction a lot with our patients, which is one of the reasons that I don't even use biological age when I'm talking to my patients. So that the computer does have the capability of toggling between giving you a printout of biological age and giving you a printout of what I call biological index. A biological index is actually sort of the same exact measurement as biological age, only instead of presenting it as an age, it presents it as a score between 1 and 100. So if your biological index is 100, that means you have a very low biological age. If your biological index is like 20 or 30, it means you have a very high biological age. This guy would probably have a biological index of about 40 or something. And so I could say, see your biological index is 40, you should be motivated to making it higher, but he's not going to get depressed in the sense of thinking, oh, I'm like a 66-year-old man. Because here's the choice. Here's the point. Biological age is not really anything scientific, is it? It's just kind of a scorecard. It's a measurement. Obviously, this 39-year-old man does not function in the same way that a 66-year-old man. So in that sense, he's not like a 66-year-old man. He looks like a 39-year-old man. He doesn't have wrinkles, and he can probably outdo a 66-year-old man. However, it tells us from the perspective of cellular energy production, it's as bad as a very healthy 66-year-old man. And it should tell him, you know what? You're from a cellular perspective, you're aging too rapidly. And although you're getting away with it now, because this is early in the game, as this goes on, as this game progresses, you're going to not be looking so good. So it's a motivational thing, and it's a thing that we can key on, because as we start him on therapy and bring him back and retest him, we obviously want to see the biological age go down, or if you're using biological index, we want to see that go up. And that tells us, you know what we're doing is in fact working. So here's his prescription. Here's what we came up with in this particular patient. He needs to be off carbs for 2 weeks and then repeat the resting part of the test. What's going to happen is, I can tell you, is that his resting fat metabolism is going to go up rather dramatically. And as his resting fat metabolism goes up, this is going to improve his overall cellular energy production rather dramatically. And that's going to affirm to us and to him, you know what? I'm one of the slow oxidizer types. I just got to watch the carbs. I'm not a fast oxidizer, sucking down carbs all day long kind of guy. We're going to check his serum fasting homocysteine to kind of qualify his methylation. And if it's over 10, I'm going to give him things that will enhance methylation. He only sleeps 6 hours a day. I know that for most people, they need in the order of 7 to 8 hours of sleep a day, or their energy quotient, their cellular energy production will go down. So I'm going to give him a trial. I'm going to say, listen, for the next 3 months, I want you sleeping 8 hours a day. Let's see what happens. I want him to lose the coffee. Once he's been off the coffee for a while, I'll let him have 4 ounces of coffee a day. I don't see a problem with that, and actually there's some benefits to that. But he's on too much for right now. It's too stressful to his body. We're going to use the exercise data on that came with the bioenergy testing to establish an exercising program of him for 30 minutes every day for 1 month, and then every other day. We're going to talk to him about the correct amount of calories that he should be eating. This is his prescription. Okay? This is his prescription for life. This is his prescription for slowing down the aging process. This is his prescription for getting healthier. This is his prescription for preventing disease. This is not a prescription for sick man. Again, he's not sick. But this is where doctors need to go. We need to go where people are already healthy by the typical standards and actually make them healthy by cellular energy standards. And then we're going to repeat the test in 3 months. And what we're going to see in 3 months is if he did the prescription I gave him, and if the prescription I gave him was in fact accurate, he's going to see an improvement across the board. We're going to amazingly see that EQ go up. And in a 39-year-old guy doing this kind of thing, I can tell you right now, in 3 months, the odds are very good he'll have an EQ of about 110. He will probably have lost about 8 or 9 pounds of body fat, and he's going to be very happy with these changes. And once I see that, then I'll just tell him, you know what, all I want you to do is just continue the program you're on, and we'll check you at this point annually for the next few years. And as long as we see that you're doing perfect, we'll probably go every other year, and we'll be doing this the rest of your life, just to make sure that you're showing us some great numbers, not only now, but when you're 50 years old, when you're 60, when you're 70. So what we're going to do now is we're going to go through a couple more cases, and I'm not going to throw all the numbers up. We're just going to kind of dialogue about them as we go through them. Okay, this first patient is a 58-year-old woman who came in to see me complaining of some knee pain and complaining of some obesity. To give you some numbers, when she came to see me, she weighed 264 pounds. When she was in her 20s, she weighed 140 pounds. So she put on 120 pounds in the last 30-some-odd 8 years. It's kind of like the last guy we talked about, only seeing him 20 years later. She had sleep apnea. Secondary to that, she was supposed to use her CPAP, but she's not using the CPAP because she's like most people that can't stand the CPAP and they'd rather suffer the problems than actually suffer the solution. And she's got hypertension for obvious reasons, and she's on a number of antihypertensive drugs. This is a patient that is so common that all of us see all the time. So let's kind of run through what we've got here on her. Okay, let's start off now with her EQ. What's her EQ? What's her total cellular energy production? We want it to be 100%. By the way, I didn't mention to you, when patients are older than the age of 40, on the energy quotient, and on all the other factors, by the way, I don't compare them to their own age bracket. So I compare them to what would be typical for a 40-year-old. So if they're 64 years old, I'm going to compare them not to what an average 64-year-old should be showing, but to what an average 40-year-old should be showing, who's their sex, height, and weight. The reason is because it's around the age of 40 that cellular energy production starts to significantly go into a decline. And I don't want people to be healthy for their age. I want people to be healthy. So I'm 62 years old. I don't want to be like a healthy 62-year-older. I want to be like a healthy 32-year-older if I can. So we are going to compare my results against a 40-year-old person when I'm 62. When I do it 20 years from now and I check myself and I'm 82, I'll still be comparing back against a 40-year-old person because that I'm using as my benchmark. Now in people that are younger than 40, I just compare them to their own age bracket. So in the last case we saw, he was getting compared to other 39-year-old men. This lady, however, even though she's age 58, is going to be getting compared to 40-year-old women, her height and weight. And according to that, she's got an energy quotient of 85. So she's at 85% of what the average 40-year-old woman, her height and weight, will perform in terms of cellular energy production. And guess what? That's not so bad. She's 58 years old. So how can a 58-year-old obese woman do so darn well? And the answer is a couple of things. Number one, and this is an observation that I think is just really interesting, but we've just seen this over the years, and what I'm about to tell you is just absolutely true. That is that if you see a man who has too much fat on board, I guarantee you he's going to have an energy quotient problem. That's pretty much a guarantee. If you see a woman that has too much fat on board, not necessarily a guarantee. Women's physiology is such that they can have a lot of excess fat, 40, 60 pounds of excess fat, and they'll actually have decent cellular energy production. It's just the way God made them, such that they can carry a lot of fat around, and it has survival value to them, I suppose, but it's not necessarily a consequence of a health problem. This is just not true for men. So if a man is overweight, it's a problem. If a woman's overweight, it may be a problem, but it doesn't have to be. Here's a case in point. Here's a woman who's obese. She's 120 pounds over the line, and yet she still has an energy quotient that's not that bad. She's got 85%. So the other issue I could tell her is, you know, you've got pretty good genetics. So given the fact that you're 58 years old and you're still producing energy along the lines of 85% of what a healthy 40-year-old woman could do, you look like the Lord gave you some pretty good genetics, and you've got some real strong possibilities here. And I would tell that to her to encourage her to say, you know, don't get depressed because you're overweight, because from a health standpoint, that's not the big issue. It's more of a cosmetic issue, I think, for you than it is an actual health issue, and there's a lot that we can do for you. Okay, but her energy quotient's down. What we'd like to see is over the next year or so, we can get it to be higher. Next off, I'm going to look at her metabolic rate, which is her M factor. I'm going to see how her metabolism's doing. She's overweight, maybe that's the problem. Her M factor is 80. Okay, it's 80%. That's definitely a problem. So she definitely has a metabolic disorder. Now, I subsequently did run some thyroid blood tests on her, and what I can tell you is that her T3 is in range, her T4 is in range, and her TSH is in range. What's not in range is her reverse T3. It's very high. So she has what would be called in many circles Wilson syndrome. She can make thyroid hormone. It's just getting blocked by the reverse T3. So one of the things I can tell you is that thyroid blood tests, if you look at T3, T4, you look at TSH, they don't tell you the whole story. There's a lot more going on to basal metabolic rate than just thyroid hormones or just pituitary hormones. It's how well the liver converts T4 to T3, and at the end result, it's how well that T3 works down in the level of the mitochondria in the cell. And a lot of the times that's the problem, because what we see is frequently people with very low metabolic rates, such as this lady here, who have fairly normal thyroid tests. Now hers is actually abnormal. She's got an elevated reverse T3, but I wouldn't have been surprised if in fact that were normal. What she needs is she needs thyroid hormone. Now she also may need cortisol, right? So how would we know if she needs cortisol? Well, we kind of go down and say, well, how well does she burn fat? Because if you've got decent cortisol levels, you should burn fat pretty well. And if we go down and look at her fat burning factor is at 92%. And her C factor, the amount of fat she burns at rest, is 93%. She burns fat like a champ. Here's an obese lady that really burns fat well. So it's got to be a combination of her cortisol and her thyroid, and or maybe so it's got to be that. So let's go and evaluate her adrenal function, and we do that by history. And the fact is that she doesn't have any symptoms of adrenal fatigue. She looks quite good there. You can evaluate adrenal hormones if you want. I've long since stopped doing that because I can tell you if somebody's adrenally depleted just by talking to them for about 2 minutes and getting their history. So I find that's not true for her. And in fact, her problem is really one of low basal metabolic rate. So she's going to need to be on thyroid hormone. If the blood tests indicate that they're all normal, I don't care. I'm going to put her on thyroid hormone anyway because there's plenty of evidence in the literature. My books go into this, by the way. Plenty of evidence in the literature that patients can definitely have a normal TSH, T3, and T4 and be low thyroid state. So I would rely much more on this than I would on those blood tests. So we'll start her on some thyroid hormone. The other reason a metabolic rate can be low, by the way, is if she has low lean body mass. And that's probably the case with her. She's dieted repetitively over her years, lost the weight, put it back on, lost the weight, put it back on. And we know that when people do that, they always lose lean body mass. And so when we do a body composition analysis on her, let's see if I did that. It looks like I did. Your body composition shows that her lean body mass is at 52%. That's awfully bad. Should be at least 70%. So a lot of the reason her metabolic rate is low is she's lost lean body mass. So when we exercise her, we're going to make sure that not only we exercise her aerobically, her EQ is a little bit low, so one of the ways to raise that is aerobic exercise. But I don't want to just limit her exercise aerobic. We need to do something to build up her lean body mass, which means I'm looking at anabolic hormones for her, testosterone, for example, progesterone, for example, and maybe DHEA, maybe human growth hormone. And I'm also specifically going to look at thyroid hormone for her to boost her overall metabolic rate. So I've already got a formulation of my plan of what this lady needs. What she doesn't need is a diet, but what she does need is something to raise her metabolic rate, which would be things that build up her lean body mass and things that build up her basal metabolic rate. So I've already hinted that her C factor, her ability to burn fat at rest, is awesome. So I know that her diet's right on. I don't need to talk to her about diet composition. I may need to talk to her about diet calories. Let's see how many calories. For longevity purposes, she would be at 1,468 calories. Now that's not to lose weight. That's just to be a healthy person with a nice, healthy level of calorie restriction. Now she's a 264-pound woman. If I send her to the dietitian, that dietitian is probably going to put her on an 1,800 calorie diet, which would be wouldn't work for her. So it's just another example of those tables that are used. The tables that are used to tell her how to exercise are just not functional. They don't work. So fortunately, I have some real data to tell her how to exercise. The tables that are used to tell her how many calories she needs to eat that's healthy for her body, they don't work. So I have some real data to counsel her. So in fact, for her to lose weight, which is one of her goals, by the way, she needs to be on 1,390 calories a day plus aerobic exercise for 30 minutes a day. So that's what we're going to do with her. And I'll send her over to the nutritionist. The nutritionist will establish a 1,390 calorie diet for her. And then also my nutritionist will talk to her a little bit about exercising along the guidelines we need her to exercise in. And that will, I guarantee this lady, that will take care of her weight. And as that takes care of her weight, by the way, and we're increasing her basal metabolic rate, you're going to see that energy quotient go up. Her biological index is 61 out of 100. It's not too bad. Kind of see that all the time. Keep in mind, she's 58, so probably going to be that great anyway. But we should see that go up. Here's interesting. Her heart factor is at 120%. What does that tell me? That tells me that her cardiac output is 20% greater than the average 40-year-old woman's. How did she get to have a cardiac output like that? Well, one is she's just been blessed. She has a great heart. Two is there's nothing sick with it. Three is because she's so overweight, she actually gets exercise. I mean, it's like me walking around with a 120-pound backpack on. So she's actually not in that bad a shape. You wouldn't have guessed any of these things by looking at this woman. If I were just a doctor operating without bioenergy testing and I saw this woman come into my office and got to talk to her, I might have come up with a completely inappropriate prescription plan for her. I might have thought, she's one step away from heart failure. She's not even close to that. However, her lung factor is only 79%. So what's happening is her lungs are getting affected. And maybe one of the biggest problems she has is she can't get a deep breath due to the huge amount of weight that's on her body. So maybe the biggest thing that we can do for her in terms of improving her cellular energy production, getting that EQ to go higher, is to get her to lose a little weight, or maybe to get her to lose a lot of weight, come to think of it. So that's my program is basically going to be geared to her to lose weight, and what that's going to come down to is thyroid hormone, evaluating the other hormones. If she's low in testosterone, if she's low in progesterone, if she's low in human growth hormone, I'm going to give her those, and I'm going to get her to exercise appropriately, which means ways to improve lean body mass. A great way to do that is a circuit training, so I'll get her to talk to a trainer to put her on a circuit training exercise program that she can do at home for 30 minutes every day. And I've got exact exercise recommendations for her. It turns out that when her heart rate is 95, that we call that the fat burning heart rate, she's burning fat maximally. Now, how do I know that? Well, the computer knows that. It can tell. So as we have her exercising on the bicycle, and she starts exercising more and more and more, she's going to burn more fat, more fat, more fat, more fat, but she's going to get to a point where her body can't burn any more fat, and it's going to start shifting into sugar metabolism. That point in her is when her heart rate is 90, when her heart rate is 95. When her heart rate gets to be 95, she's maxed out at her fat burning. We call that her fat burning heart rate. Technically speaking, she could go out and exercise with a heart rate being at 95 more or less all day long and never run out of energy. So we call that her recovery point. Now, as she continues to exercise, and that's what she's going to do during the test, she's going to get, exercise is going to get harder and harder and harder. Her heart rate is going to be going up higher and higher past 95. And what's going to happen at that point is after 95, as her heart rate increases beyond there, she's going to be progressively burning less and less fat and progressively burning more and more sugar until she gets up to the next heart rate, which is her anaerobic threshold heart rate, which in her was 115. So if she gets up to 115, she's not going to be burning any fat at all. At that point, she's nothing but sugar metabolism. Now, as she goes beyond 115, she's in anaerobic metabolism. So if you look at the chart there, and what we can kind of tell her where she is on the chart. Number one, she's in column 3. I know that because her EQ is low, so her EQ is dropped. And I can tell her that when she's burning maximum amounts of fat, right here, her heart rate is 95. When she's burning maximum amounts of glucose, her heart rate is 115. And as she gets above 115, she becomes anaerobic. This is unhealthy to stay at for any long period of time. So when she exercises, I don't only want her to spend a minute or two up here. And we do what's called interval training. What she will do, and the test report will tell her exactly how to do this, and then my nutritionist will go over this again with her. But what we'll have her do is we'll have her exercise at this point 115 for about 2 minutes or so. Then we'll have her go for 30 to 60 seconds, much higher. At the end of that 30 to 60 seconds, she ought to be way out of breath. And then she's going to slow the rate down and let her heart rate come all the way down here to 95. And she's going to stay there for about 5 minutes. I want her to spend a significant amount of her exercise time at this point right here, because that's her recovery zone. And then we're going to do this 2 or 3 times. And that'll add up to about 30 minutes. So she's going to go, just to recoup, about 2 minutes at this point. She's going to go about 30 seconds or maybe a minute at this point. Then she's going to go about 5 minutes at this point. And so I've been able to totally dial in her exercise so that she does not spend an unhealthy amount of time in anaerobic metabolism. She spends a decent amount of time aerobically and a fair amount of time, and a goodly amount of time just burning fat, because that's what we want her to do. So that's all I'm going to probably do with this lady. Again, to recap, we'll put her on some thyroid hormone. We'll put her diet's fine. I don't have to counsel her there. In terms of supplements, I have a basic supplement, which I mentioned before, called my Super Immune Quick Start. It's a fundamental supplement. It just has protein in it, things to detoxify the liver, like N-acetylcysteine and glutamine and saw palmetto, and it's got things to help with the circulation, like ginkgo biloba. And it's got lots of detoxifying things like spirulina and oat bran fiber, blah, blah, blah. It's also got all the vitamins and the minerals and the antioxidants. So this is a nice basic powder to start her on. So I'll start her on that. And we'll just get her to exercise, and we'll follow her over time, because what's going to happen over time, I'll repeat her test in say 4 or 5 months, and we'll see that in that time she probably will have moved to this column, if not in this column, at least closer to this column. Her EQ will come up from 85 to maybe say 90, 93, 94, and of course eventually if she stays with me and keeps working with me, within say about 7 or 8 months she will have lost all her weight, and she will be, if not here in this column, she will be in this column, and eventually we'll get her over here. So she'll be a 58-year-old woman at the maximum of her health. She will get her aging process to be slowed down to about as slow as it can possibly get. We'll get her to a disease risk level that would be significantly lower than what it is now, and practically nil. And I couldn't have gotten anywhere close to this without having this kind of information. So that's that lady. Let's take another case. Here is, this man here is, he's 59 years old. And let's take a look at him. His weight is 227 pounds, and he's actually 31 pounds overweight. So he's not as overweight as the last patient we looked at, but he's overweight, and he's a 59-year-old guy. So let's see what his energy quotient is. Whoops, his energy quotient is 44. So this man is in serious trouble. And again, it kind of reiterates what I told you before. Here we've got one lady who's the same age as him. I think she was 59, same age as him, and 120 pounds overweight, who's got twice the cellular energy production of this guy, who's only 31 pounds overweight. I'm just telling you, women can, as a rule, handle the excess weight. It doesn't mean it's a health issue, but men know. For this guy, he's in deep trouble. His energy quotient right now is at 44%. In the 19 years that's gone since he was 40 years old, he has cut his cellular energy production in less than half. So he's really going down the tubes. Let's see what he's complaining about, by the way. He has some pain in his foot. So he's got diabetes type 2, he's got hypertension, he's got neuropathy, and he has a history of angina. So yeah, I mean, obviously this guy is in a lot of trouble anyway, medically speaking. So he would be in this column here. That's where he is. Can we do something to move him in that direction? Yes. Could you as a physician have come up with some treatment recommendations for him without bioenergy testing? Absolutely. But what you're going to see is, using the results from the bioenergy testing, we can pinpoint him better, and then we can have a way of following him, because his EQ is 44. In 4 to 5 months, I'd like to see that thing at least get up to 60. Now, if he came back in 4 or 5 months and his EQ was still 44, something's wrong. Either I didn't come up with the right program for him, or I did and he's not doing it. But something's wrong. So we do have a method here using the bioenergy testing, not only to come up with some treatment recommendations to help this gentleman, but to also make sure that what we're doing, what we're recommending to him, is in fact improving his cellular energy production. Okay, so he's got a very bad EQ at 44, one of the worst I've ever seen. How's his metabolic rate? His M factor is 100. So you would think this guy would probably have a terrible metabolism, but in fact he's got a pretty good metabolism, unlike the former patient, one we just saw before this. Okay, nothing to fix there. Let's go down to how well he burns fat. His C factor, how well he burns fat at rest, is at 87. Now I questioned him and I asked him, how you been eating the last 4 to 5 days? And he said, you know what, I've been on a really low carb diet. And I said, you know what, your resting fat metabolism is almost at 90. It's not bad. This low carbohydrate diet that you've been on the last 4 to 5 days, I want you to stay exactly on that. Don't change that. And he says, well, that represents a lot less carbohydrate than I'm used to. And I'm saying, yeah, but it's a good start for you. So stay on that program. So we're going to make some changes in his diet, and I'm going to have him continue to stay on a low carbohydrate program. He will talk to my nutritionist, and she will talk to him more about that. His fat burning factor, which is his body's total capability of burning fat, when we exercise, is at a lousy 53%. This guy has some serious problems burning fat. So I'm going to have to really come up with a better formula for him. And so let's go back and look at this chart right in here. So what I'm telling you is he doesn't burn fat very well at all. He's a horrible fat burner. Now, even when we exercise him, so that means it's not because he's a fast oxidizer. He's a slow oxidizer. How do I know that? Well, you just look at him. He's overweight. It's pretty easy to tell. He's the mesomorphic type. On the football team, he would have been the lineman or the fullback, not the wide receiver or the defensive halfback. But at any rate, he's a slow oxidizer. He's supposed to be burning fat this way, and he's not doing it at all. What could be the problems? He might not have enough cortisol. Let's look and let's see. No, that doesn't seem to be a problem with him. He doesn't have any symptoms suggestive of low adrenal function. His metabolism looks okay, so it's not thyroid. There's something wrong with his insulin mechanism, and yes, he's got type 2 diabetes, so he has a significant problem around here. So there's some issue here that we need to deal with. But the fact is that he is not burning fat well. So what's the kind of things we're going to give to him? We're going to give him L-carnitine. We're going to give him a lot of niacin. We can check his fatty acids. His triglycerides are probably going to be sky high. Well, let's see. I don't see him right off the hand, but see if I can. I'm sure his triglycerides are pretty high here, given the numbers that we're seeing on this thing. But let's see if I can find him. I don't see him right like here, but I'm going to give him lipoic acid because even though the chart doesn't mention it, lipoic acid is a key element for burning fat. So we'll give him prescriptions like that, and let's see what I in fact gave him, and I did. We also tested him for low testosterone. He was very low in his testosterone, so we targeted him on testosterone. Again, you need testosterone to burn fat too, so you need your anabolic hormones. So as I look at this guy, he's got a terrible EQ. His metabolism is okay. His resting fat is okay on a low-carb diet, so as long as he stays on that, he's going to be good. But his fat burning, his lesion is basically this. He can't do this. And for a diabetic who can't burn fat, that means the only other choice is they got to burn glucose. For a diabetic, that's a hurting situation. So the only hope for this guy, according to the bioenergy test, is to upregulate his fat metabolism. What's the other way I can do that besides what I've already talked about? We've talked about anabolic hormones. Is exercise. Exercise. So exercise in this guy is going to turn out to be key and huge, and that's what I can tell him. I can tell him, you know, of all the things that your physician can tell you, the one that you're going to get the most bang for your buck is in exercise. Now, if we look at him again to use this graph, here's where he is. Can this guy ever get here? I would say the odds are slim. It's possible, but I've been doing this a long time. I would say the most we're going to do is get him in here someplace. If I can get him over here, I'd be one happy doc. If I could get him here, I would be thrilled. Probably we're going to get him here or somewhere in between here. But at least we're going to move him out of there and a little bit closer. So he'll be healthier. He'll have a better quality life as he gets older. I would have loved to have gotten a hold of this guy, say 10 years ago, when he was in here before his doctors made any diagnosis of diabetes at all. I'd have done the bioenergy test on him. I'd have found out he was here, and I could have stopped him from ever going here. But at this point, it may be too late. Remember, you get over this thing, and you got a certain amount of mitochondrial decay, and for this 59-year-old man, it may be a little too late to get him over here, but we can still work with him. In terms of exercise, let's look at his exercise numbers. They're just horrible. By the way, his biological index is 30, which is as bad as it gets. It defaults out at 30. Can't get any lower. So in terms of his health standpoint, he is definitely in this column. But look at his exercise numbers. His fat burning factor, let's go to this column here. His fat burning heart rate is at 80. So he's maxing out at a heart rate of 80. That's hardly like, just walk across the room. He's maxing out at his glucose, his anaerobic threshold is at 85. So when his heart rate gets just like 5-point difference between here and here, he's starting to get anaerobic already. This guy gets anaerobic walking across the room. Now, exercise physiologists may tell you that's impossible, but I'm here to tell you it's possible. We see it all the time. This guy's anaerobic, basically doing, he's got horrible, horrible physical condition. One of the ways you can measure your physical, or determine your physical condition is what's the overall difference between your fat-burning heart rate and your anaerobic threshold heart rate. If there's a wide variation, you're in pretty good shape. Now, the previous woman, remember, I think her heart rate was on the one end, it was, I want to say her fat-burning heart rate was 95, and the other end was 115. That's not a real wide spectrum, but that's a 20-point spectrum. That's not terrible. This guy's spectrum is only 5. There's only 5 points difference between maximum fat and maximum and his anaerobic threshold. Means she was in fairly decent shape, and if you can remember, cardiac output was excellent. This guy is in terrible shape. Now, here's kind of the good news in this, and this is what I would tell him. I say, here's the good news in this. You've got a real problem. You've got some diseases. You're in this column, but we found that probably if you just get yourself in good shape, you're in such bad shape now, you might seriously recover a lot of your disease process just by getting in good shape. So this man, bioenergy testing has taught me that the key to this man is his diet, low carb, because that's working for him, and exercise, 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 and exercising absolutely appropriately. For me to send him to a gym without the guidelines that I've learned on this test, where he shouldn't be going over a heart rate of 85 very long, those people in the gym, I guarantee you, they'd have had him at a heart rate of 115, 120. It's more or less a guarantee. Because they wouldn't have known better. They don't have access to this data. They wouldn't have known better. And they'd have just been hurting him. And he'd have been getting disgusted. He wouldn't have seen the results. He wouldn't be getting any healthier. It'd actually be hurting him. They'd have been exercising him up in here. Because they'd assume he was like this guy or something. But they'd have been totally wrong. He'd have been exercising all wrong. He would have hated it. He wouldn't have gotten worse. But what we can do is prescribe exact right exercise and be all over him in terms of exercise in his diet. And yes, we go on and we give him the usual things that all you docs out there right now are thinking. You're thinking chromium. You're thinking lipoic acid. You might be thinking vanadyl sulfate. But you're thinking all the things that we know about. In herbs, there's a whole bunch of herbs that could be maybe helpful for that guy. But in terms of what's going to get him the biggest bang for his buck, it's exercise. Okay, so good. We've seen 3 fairly different patients with different results and things that the bioenergy test has helped us to gear in on those 3 patients. And I got one more left for you. So just stick with me. This won't take too much longer. And this one's going to be a little bit of a different case because I took a peek in ahead of time and I know. Now, this lady is one on whom I apparently have done a lot of them. So let's just look at her. I first saw her in 2005 when she was 35 years old. At that point, her energy quotient was 71. Okay, that's not all that great. For 35-year-older, that's 30% less than the average 35-year-older, her height and weight. She was about 8 pounds overweight. Let's see what she was complaining about. She notes that her mom has diabetes, but other than that, she didn't feel too well and she just wanted to lose the weight. I mean, she didn't feel too badly and she just wanted to lose the weight. So that was basically her goal. Let's lose some weight. Now remember, I told you some women can be overweight and be in great shape. She's not one of them. Her energy quotient was all the way down to 71. Her metabolic factor, her M factor, was at 86, indicating that there was something wrong with her metabolism. Could it have been thyroid? Could it have been adrenal? I look at her adrenal history. There's no history to suggest that she's adrenally deficient. So I think that's probably not the issue. So I'm thinking more of her thyroid. And so I'm looking at my chart now. I'm seeing I did put her on thyroid. Okay, so that's one thing that even though her thyroid blood tests were normal, and I couldn't have known she needed to be on thyroid had I not had this bioenergy test. I put her on thyroid anyway, even though her blood tests were in range. Now I'm going to make sure, as I put her on thyroid, that I repeat the blood test and that I keep her T3 and her T4 in range. I'm not going to worry so much about her TSH, because remember, she could have a metabolic disorder at a cellular level which won't be reflected in the TSH. The TSH could end up getting suppressed anyway. I'm going to care about her overall metabolic rate. And I know that her overall metabolic rate is at 86%. It's a little bit down. So that's what we're going to work on with her. Just a little bit of thyroid, throw that in there. But how well is she burning fat? Remember, her chief complaint is being overweight. Well, her C factor is at 75. That's fairly low. That's her resting fat metabolism. So that's fairly low. Her fat burning factor is at 72, so she basically doesn't burn fat that well. And one of her reasons is probably that she eats too many carbs. So I would put her on a low carb program and bring her back and then retest her to make sure that her C factor went up. And I would give her cofactors similar to what we did with the last patient, maybe some lipoic acid, maybe some niacin, maybe some L-carnitine, maybe some herbs to help her burn fat better, like green tea extract, something like that. We've given her the thyroid, that'll make her burn fat better. I'm taking her off the carbs, that'll lower her insulin levels and let her burn fat better. And so I think I got a pretty good program for her already. And then I'm going to go ahead and put her on an exercise program. Now, there's a big difference between her and some of the other cases. Her fat burning heart rate was at 110. So, by the way, she would be in this column right in here. Her EQ is lower, so she's in this column. She burns fat maximally at a heart rate of 110. She becomes anaerobic at a heart rate of 130. There's no way that we could have predicted this with equations. We have to measure it. So when I send her to the gym, I'm sending her arm to show her trainer, listen, she's going to max out anaerobically at 130, so don't have her working over 130 very long, maybe 2 minutes every now and then. That's all. Mostly we like her hanging out at 130, and then we like her doing a lot of recovering here at a heart rate of 110. Now there's a 20-point difference between that. So she's in pretty good shape. Well, she should be at this point in time. She's only 35. What else can I tell her? Her heart factor back then was only at 69%. So she was in much worse shape from a cardiovascular standpoint than I would have imagined. Her lung factor was at 72. Now that's not very good, and it makes me wonder if she didn't even have a little reactive airway. Although I will tell you that when you measure FVC, sometime if the patient isn't well motivated, you get a low number. And so it may have been that she wasn't well motivated and didn't really take as deep a breath as we wanted her to. So let's flash up now. So that was in 05. Let me just go to the next test and see what happened. Okay, so that was in March. No, let me see. That was in December of 05. The next time we've got her is in April of 06. So let's see what happened. And in fact, let me tell you exactly what I did with her. I put her on some fat-burning herbs. I put her on some niacin, some carnitine. I put her on coenzyme Q10, an exercise program. I put her on some thyroid extract. I gave her 2 grains of desiccated thyroid hormone. I put her on a lower carb diet, and that basically was the intervention. So let's see what happened. She came back, and her energy quotient was still 71. In other words, it hadn't gotten much better. Her M factor was identical, no change there, and her fat-burning factors were all identical. No change there. In fact, this test looks absolutely identical to the one we did in December. Even down to the exercise numbers, it's literally identical to the one we did in December. So basically, let me take a look at my note. My guess is she didn't do anything I told her. So let's just see here. Um, well, that's exactly what happened. She came back and said that she got sick, and she just bagged the whole thing, didn't do anything. So in essence, the second test was sort of helpful. It kind of shows her, if you don't change what you're doing, probably nothing's going to change. And that's certainly the case. And to be optimistic, I told her, you know what, at least you're no worse. So I said, go back on your program, and let's check you back a little bit later. And let's see what she came down with. And that's April of 06. So then let's look at 4 months later. And 4 months later, her metabolism's finally starting to come up. Her C factor, which is her ability to burn fat, has come up. Her metabolism is now at 91%. I would consider that normal, so the 2 grains are working pretty nicely there. Her C factor, ability to burn fat, has come up from 72 to 86, so her carbohydrate diet's working well there. Her fat burning factor, if you will recall, was way down there around 70s. It's now up to 91, so she's burning fat better. She has dropped 4 pounds, not amazing for 4 months, but being as how she's not following the calorie program all that great, and she's more or less happy with how she's doing. Let's see with her heart factor. Remember, it was terrible. It's up a little bit to 74, but all in all, she has not, and her energy quotient is still 73. So even though she's looking a little bit better, even though she's starting to move her fat, she's still in this column. She's moved a little closer to this column, but she hasn't got to this column yet. Okay, let's see if I have any more data on her. It would be really nice to maybe, that was in 8 of 06. Let me see if I have something more recent on her. Okay, this is good. So this is in 12, nope, sorry, wrong date. Okay, so this is in 12 of 07. 12 of 07. Finally, we hit pay dirt with this woman. Her weight is more or less the same, but her EQ is now at 116. So she's moved now into this column. She was over here. She gradually inched her way over, and now she's finally in this column. The fat burning and the glucose has also improved. Her C factor is now at 100. That's really hard to believe. Her fat burning factor is at 123%. So she is dramatically, she's actually in between here and here. So she's done really well. Now, why is this particularly motivating? Because here's a woman who's only 35 years old. She's not in this column, but she's in this column. And left to her own devices, remember, mom's diabetic, so left to her own devices, I could almost guarantee you that this weight she's gaining is just the tip of the iceberg. That in another 20 to 30 years, some doctor somewhere would be diagnosing her with a list long of medical conditions, all of which would have been 100% preventable had he known 20 years earlier that she was here and been able to use this data to move her more in that direction. And so this for me is why I am in medicine these days. A case like this is why I go to the office, because I know that this woman here stands real good. She's learning a real good chance of living long and living well, not getting any of the diseases that her mother's gotten, and having a very high quality of life as she gets older. I know that by working with me over the last year and a half and looking at these bioenergy testings and seeing what happens when she does it like she's supposed to, and seeing what happens when she doesn't do it like she's supposed to, and seeing how she's improved, I know that she's learned how her body works. She's highly motivated. She feels in control of her body. And just like an athlete, she's kind of in tune to what her body needs to get the results. And I know that at this point, she's not going to need a lot of my supervision to continue to move in this direction. And I wouldn't be surprised if not too long, one of these days, we see her right up in there. And that'll make my day when I see that. And we see lots of cases with this. Possibility is she may never get here. It may be that she just doesn't have the greatest genetics. So not everybody's built the same. Some people have fabulous genetics, some don't. But that's not the point. That's not the issue. We can't alter our genetics, but we can alter the way we live such that no matter where we are on this spectrum here, we can move ourselves away from disease and to health to a major degree by making these changes that we've talked about. And to me, the key to that entire process is bioenergy testing. So that brings us kind of to the end of this part of the lecture series. I do want to just leave you with some contact information. That's the office phone number. This is our fax number. We have 2 websites. They're both pretty easy to remember. One is Anti-Aging Medicine, all strung together, antiagingmedicine.com. The other one is bioenergytesting.com. If you're a physician out there and you're interested in being able to measure your patient's cellular energy production and get all the tremendous benefits from that we've talked about here in these last 4 parts to this series, just get a hold of us. If you're a patient and you're interested in having this test yourself, you can go to the bioenergytesting.com website, and there's a referral list in there of all the clinics that have this test available, and you can find the one that's closest to you. Right now there's not nearly as many doctors utilizing this new technology as we hope there will be in the years to come, but hopefully there'll be somebody that's not too far away from you. Just remember, the first year or 2 that you're into doing this might only have to get the test every 6 months. So even if they're far away, to me, this is well worth the opportunity to fly into or travel to where you need to go to get the test done so you can fine-tune yourself and more or less guarantee that as you get older and live longer, you'll have full of energy, you'll be bursting with energy, and you'll have no disease, and you'll feel great and be fully functional. I anticipate that we could all live to be celebrating our 100th birthday by riding our bikes up a mountain and then having a nice party afterwards. So until we meet again, thanks for watching this 4-part series, and best of health to all of you. God bless.